Meeting presentation.
Yes, a lot of what you guys mentioned in the chat, you're going to maybe hear again a little bit as Christy and I talk. We can go to the first slide. We split this up because we have sort of different perspectives that we're bringing to this conversation around this topic. So, as the physician on the team, we're going to talk a little bit about medical things to consider and when to be worried and when to use some of the strategies that were discussed during the session today. We know that people on the spectrum are more at risk for nutritional vulnerability, and there's lots of reasons for that, right? They may have some behavioral differences or interests that might restrict the types of foods that they're willing to taste or try based on the color or the brand or how it's presented or how it feels, which is the second bullet. Those sensory sensitivities can include food textures, but also the environment that they're in while they're eating. They also have increased rates of other gastrointestinal problems, so higher incidence of reflux, constipation. And so if their tummy's not feeling good, that might impact what they're willing to eat or how much they're willing to eat. And then we know that in some communities and some families, they are thinking about elimination diets where they're removing certain groups of foods from their loved one's diet, like often gluten or casein. And there's not great evidence that this works for all autistic people unless they have a true gastrointestinal reason to need to remove those foods. But that does also then narrow the types of food choices that they're making when they're eating. Next slide. So this came from actually a presentation that we have given to doctors and healthcare providers on this topic, but I really, really love it because it helps to sort of differentiate what might be considered a picky kid versus a kid that truly has like problematic eating behaviors. So the two columns have each line is like its own topic, but the two columns have the subtle differences that might help you as a family member to recognize, oh, we're actually just in the picky category versus maybe we're starting to move toward problem eater. So picky eaters, they typically eat with their family. They just might only eat the foods they like from the meal and be a little resistant to a non-preferred food. Whereas a problem eater really always needs to eat something different and may even choose to not eat with the family or eat at a different time than the rest of the family's meal. A picky eater that tends to have a smaller range of foods that they're willing to eat, but they'll eat enough foods that you can get something from each food group, and they have a decent enough variety that they can usually find something at a social event. Whereas a problem eater may be getting more and more restricted in terms of how many foods they're willing to eat and try. Like, so 30 versus less than 20 foods is sort of the magic number. Picky eaters may eat a food a lot in the beginning and then kind of get tired of it and move on to something else. But usually they'll return back. Like if it's something that you want them to eat and they ate it for a really long time and then they needed to take a break, they'll usually reintroduce it into their diet. Whereas a problem eater, if they decide that they're not going to eat a food that they used to eat, it's really hard to get it to add back into their diet. Picky eaters will typically accept a food being near their plate, on their plate. They might be willing to touch it. They might even be willing to taste it. They just won't eat a whole serving. Whereas a problem eater may not even tolerate the food being within their line of sight. A picky eater will typically consume something from each food group, but a problem eater may have whole food groups or whole chunks of types of food textures that they're not willing to try. Multiple exposures for picky eaters is absolutely the case. Kids need to be introduced to a new food that they're not necessarily jazzed about trying, sometimes 20 to 30 times before they will really decide that maybe it's okay to eat it. But a problem eater, even after multiple attempts and introductions, still is not willing to try a new food. Um, Picky eaters might only eat certain food types. Problem eaters might be very brand specific or presentation specific. And then picky eaters, parents will say he's picky, whereas problem eaters will say it's really a struggle. Like we're worried about his eating because it's getting harder and harder to have a meal. So this is a nice visual. I know it's a lot to cover, but I think it does help to sort of differentiate where your loved one might be as you're thinking about how hard is eating in my child or loved one's life. Next slide. So things you can ask yourself, right? Is this person in my life consuming at least something from each food group? What happens when I offer a new food? How often am I offering a new food? Am I doing this all the time and it's a fight constantly? Maybe we need to back off a little bit. If I do offer a new food once a week, is it easier than if I do it every single day? Um, will my child or loved one eat at the table with the rest of the family, or are there other environmental things we need to consider? Um, in the past 6 months, have you gotten your loved one to eat any new? This says child a lot. Sorry, guys. It may not always be your child. It could be a grandchild, a niece, a nephew. But what foods has your child added to their diet in the past 6 months? It doesn't have to be something they did in the last couple days, right? Just have they added anything in the last 6 months? Do they tend to eat regular meals and snacks, meaning that they have a breakfast, they have snack, they have lunch, or are they kind of grazing all day long and never really sitting for a meal? Um, as a family, are you generally sitting and eating mostly the same foods at your meals, or are you needing to make a very special meal for this individual because of their selective choices? And then fluids. I asked a question because constipation we know is a bigger issue. And so, what fluids are they consuming and when? And are they consuming enough? And if it's only milk, that's a different story than if it's never milk. And so all of those are things to think about. Next slide. And then this came up in the chat as well. When should you talk to someone? When should you be concerned enough that you're bringing this to a visit? So any signs of weight loss, or if they're not even gaining weight, so a child where their clothes that fit them last year still they're getting short, but they still fit them around the waist and the body, means that maybe they're not kind of growing horizontally as much as they're growing vertically. Any signs of pain, right? So if a child is showing pain when they swallow, when they eat, if they're seeming really uncomfortable for eating, that would be a reason to talk to a physician. If they're having like diarrhea or significant constipation because maybe their diet is so selective that they're not getting enough fluids or enough fiber. Irritability, depression, anxiety, any those can be signs of malnutrition in some cases. So if a child is having significant changes in their behavior that are new, this is not like an ongoing irritability, depression, anxiety, but wow, this is really new. I've noticed the diet's gotten more narrow and his mood's changed. That would be a reason to talk to someone. If there's any signs of like temperature or heart rate changes, again, these are all signs of malnutrition. And then the other box has additional things, right? That may be more subtle. They may not be like, oh gosh, we need to get to a doctor right away, but it's a sign that maybe something is missing from the diet. It could be that you start with your primary care provider. I think this might be on the next slide. Um, you could talk to your primary care provider, and I always encourage you to start there because they know your family the best and the most, and they can maybe help to triage. Yeah, this seems like really problematic, and there's some healthcare concerns here. Let's get you to the right specialist. But that could be different things depending on the concern. So if it's, hey, I'm worried that my child's not getting enough nutrients or they're not eating enough of a particular food group, maybe it's just starting with a nutrition consult or a dietitian. If there's other things like diarrhea, constipation, pain with swallowing, maybe we need to see a gastroenterologist and make sure there's not reflux or some other bowel issue going on. If there's signs that a particular food is not being tolerated or there's other sort of allergic symptoms, maybe it's an allergist. Maybe they're having some sort of allergic reaction to a food ingredient. Or if there's growth concerns where either they're not gaining enough weight or they're not growing in length the way we would expect, or they're losing weight, sometimes an endocrinologist needs to get involved. But that's where your PCP can help to sort of tease out and figure out what the next right step might be. Next slide.
Okay. Please bear with me. I am losing my voice, so I hope it sticks through the rest of this presentation. I absolutely love everybody's recommendations and thoughts on the case study. So thank you so much for sharing. Um, I'm going to talk a little bit about picky eating. I kind of wrote down just like a whole list of different things to think about that you might want to try. Um, and a lot of the things that you guys have shared are suggestions that are listed and just like really, really helpful and good insight. So really picky eating can be defined as difficulty eating a variety of foods. It's very common in most people, but it is really significantly higher in autistic individuals, and in some studies is up to 90%. And it's really commonly, I can tell you as an OT, I hear this, it's like a very common source of stress for families. It really seems to impact like all areas of life. And so it's very important to support families in that way. Next slide, please. Some themes that seem to be related to picky eating and autism. Diets can seemingly be based on like a flavor or a color, so bland foods by like a white diet. There is often like a texture preference, maybe you're eating only crunchy dry foods. A lot of eat and they may often like might be like 6 or 7 and still want to drink from an infant bottle. It's just like not typical for their age. Maybe they want to eat in a certain way, so they like to like crumble all the foods before they eat, or they might eat like one grain of rice at a time. Some individuals will select out like entire food groups, so absolutely no vegetables, no fruits, no meats. Some individuals can be really brand or presentation specific, so will only eat a yogurt if they see the Gerber baby on the label and can tell if you put like a different type of yogurt um, in that container. They might only eat one specific brand of like a dino chicken nugget, or they won't eat a potato chip if it's broken and it needs to be like whole. And then what we call food jags. So that might be like something where a child might like love a food for weeks at a time or wants to eat it 6 times a day, every single day, and then just suddenly just stops eating that. And maybe never kind of regains that food. Or children might go days without eating or drinking, and seemingly be fine, but just refusing. Next slide, please. And then the why. So Dr. Bennett talked a lot about some physiological factors. Another reason that I often see is there's an oral motor difficulty or a lack of a physical skill. So a child just doesn't have the ability to do something. Often see sensory sensitivities and rigidity, which is kind of that need for sameness and routines. That is a characteristic of autism. That can also lead to or be related to anxiety or fear. And then the other thing to think about is there was a lot of things if, the child in the case study was motivated by watching other people eat, is that often autistic individuals just aren't as socially motivated to eat. It really doesn't matter as much as like what everyone else is doing around them. That's not for everybody, but there are some children that just that social desire is not there. A lot of how we learn to eat as a child is based on social modeling. So, and coming to the table and going to parties and just being at holidays with family and friends, there's a whole social aspect to it that is also can be um, challenging if you're having difficulty eating as well. Next slide. So some physiological factors, Dr. Bennett talked on a lot of them. Some other things to think about is like, is there dental issues? If your child does not like having their teeth brushed, so dental hygiene isn't great, they might be having some pain. Younger children, I'm always asking, like, do you think teeth are coming in? Those are things to pay attention to. Um, you can always put another side of like a extreme kind of medical factor could be like aspiration. So things are going kind of into their airway. We see a lot of kids that just with an autism diagnosis or for something else might have decreased postural strength, control, motor issues. That might make it difficult to just physically eat. Same thing if you have a challenge with your breathing, that can also make it just difficult to eat. So, we always first want to keep our head up and being able to breathe. That's a body's first priority. Feeding's actually like the third priority in a body. Next slide, please. Some oral motor difficulties could be a reason. So, some individuals either consciously or unconsciously shy away from foods that are challenging to move around in their mouth or chew or swallow. So, this could lead to a food texture preference. So, a child that might have difficulty chewing, um, like a piece of steak, might prefer foods like smooth textures or something that's meltable, like a cheese puff, because they don't really have to work so hard. It easily dissolves and it's easily to be swallowed. Mixed textures can be challenging for this reason. So think of something like a soup, like a chicken soup that has pieces of chicken, vegetables, and a broth and noodles, and your brain's confused of like, am I supposed to swallow this? Am I supposed to chew this? Certain textures are just more developmentally advanced. So just as every child with autism kind of develops at a different rate, you can kind of feeding is the same thing. You go through like a developmental progression. So it is possible that you're just not developmentally ready for a certain texture. Um, and so that is just like always something to think about as well. Next slide, please. And then there's always the sensory sensitivities, which go hand in hand with autism. So one of the big ones that I find is difficulties with interoception. So being able to know if you're hungry or if you're satiated. Um, Another thing is like too much is going on or conversely not enough. So there might be too much going on in the environment. There could be too much going on in the food. There's too many colors. There's too many flavors. There's too many textures. Some kids, it's the opposite. Like it's they need a little bit more. They need some crunch. They need some variety. They need some spice. They need to eat in a busy environment. You know, I hear kids that eat really well at restaurants, but eat terribly at home. And it might be just that there's a lot more stimulation and their bodies are a little bit more aroused and ready in a restaurant situation than at home. Um, Kids could have tactile defensiveness that could be on their body, that could be in or around their mouth. They also could have decreased tactile awareness. So they may be putting lots of foods in their mouth or then they're not feeling where they are in their mouth. That might cause them to try to swallow a big piece of food. Then they choke, and now I don't want to eat that food ever again because it made me choke. There could be a hypersensitive gag reflex, so everything that goes in their mouth, that gag reflex is just happening. It could be hypo, so they don't have a gag reflex. So then they're really just like over swallowing foods that they haven't chewed properly, which can cause some issues. There could be like a visual defensiveness that they just like the way, like want things to look a certain way or look in order. And sometimes food can be chaotic looking, and that might be too much. Might just have difficulty sitting still or attending to meals. And then, of course, you're always going to have sensitivity to certain smells or tastes. Next slide. And then some rigidity just related around meals. That's like, it is a diagnostic criteria for autism. Kids really thrive and crave that need for sameness and predictability. It's calming for them. Previous experiences that you've had, you ate an Oreo, it made you threw up at some point. Now you have this like long-lasting effect that you're like never going to eat an Oreo again. Autistic people might just have a harder time like forgetting that or habituating to that. One thing always think about is food changes in your mouth. Like when you put, a piece of chicken in your mouth, you chew it once, it changes shape, it changes texture, it changes flavor, and every time you chew and your saliva mixes up, it changes. So it's unpredictable. And certain foods taste different. So, if a blueberry, you have one blueberry, it's super ripe, it's super sweet, you like it. The next one that you eat is tart, it's squishy. So that can be if you're a little bit fearful of the unknowns, that can make eating challenging. And then all of this can also lead to more like a diagnosis of anxiety. Next slide. All right, so I'm just going to go through a whole bunch of practical ideas to think about. I said you guys had some really excellent suggestions and thoughts. So I think a lot of this we've already been talked about, but really make sure that you rule out or you try to limit some of the physiological or medical issues that might be impacting feeding. And then seek help from a professional depending on what might best support your child. So that I think is really important. There is not a one size fits all. I think a lot of times, based on developmental level or age, one approach is just not going to work. You're not going to be able to reason with a 5-year-old and say, no matter any 5-year-old, like if you don't eat this, you're going to get sick and you're going to be tired and not be able to play sports. That's just not how a 5-year-old thinks. Maybe someone who's 16, 17, 18 might understand that a little bit better. So the way that you approach how you might address picky eating is going to be different based on understanding developmental level and like kind of what motivates a child, as well as some of the other factors we talked about. Um, Speak to any professionals that know your child well, as they might be able to help decide on like what strategies might be the most helpful. Be really aware of the surroundings and your child's sensory state. You might need to limit distractions or you might need to add a little bit of stimuli. Always brush your teeth after eating. Toothpaste can change the taste of food. So sometimes, you brush your teeth first thing in the morning and then you want to eat breakfast and you're like, oh, wait, now that tastes really gross. It's because you just maybe brushed your teeth. Keep a list of yes foods, a list of maybe or previously eaten foods, and then a list of like no foods. Always try to offer a piece of like a maybe or a previously eaten food on a child's plate. And just when I say piece, like tiny little piece as to maybe not visually overwhelm. Some kids see an amount of food on the plate and they just automatically think like, I need to eat that. So by keeping it on the smaller side, you're kind of giving them a cue that even if you do eat it, it's a very, very tiny piece. Try to manage your own stress. Children like very much can manage, sorry, can sense our stress. Just try to remind yourself that feeding and eating should be fun as long as there's no major concerns about health. And that's kind of like a whole different animal. Next slide. Sometimes it's going to feel like you're going backwards. That's okay. Sometimes you have to help like unlearn a behavior or a previous like scheme related to feeding, and then you can help relearn a new one. Try to create a routine around eating. So maybe the same place or same time of day. If your child attends school, ask them how they manage meals and snacks there. Um, Keeping like a structure around meals, it makes eating predictable. It helps children learn what's expected of them. You can use things like visual cues, picture schedules, other positive behavior supports, kind of like helping having a child help get ready for a meal, maybe help clean up the meal. I know kids like often love to like play in water and wash their hands. So it's kind of like a reward when you're finished eating, you get to wash your hands, play in water. That's something to think about. Pay attention to a child's age and their attention span. 2-year-olds really can't typically remain seated for more than 5 to 10 minutes anyway. So if you're expecting them to sit for 20, 30 minutes, either with like a family for a meal, give them some toys, or if you expect them to eat like food for that long, now it just might be just too much from them from like a physical perspective. Positioning is really helpful. So you want to make sure that they're positioned well in a seat. That helps them use their hands, helps their bodies feel regulated. It also can create kind of like physical boundaries that might help children with attention. I often find some kids that are really, especially sensitive to touch, like on their hands or like on the outside of their mouth. If you teach them to feed themselves with utensils, that can give them a little bit of like, I can limit how much tactile information's on my hands. I can keep it from getting on the outside of my lips. It also helps kids feel that they have some control if they feel at any point in feeding that they're being fed passively versus them being kind of an active participant in eating. Be mindful of the way food looks, it smells, feels, and then just think about what could be done differently to that. For example, air fry a vegetable. I like to like blot liquid or off of like strawberries or other like wet foods to make it ways. Try food coloring, deconstruct a food like a taco. You instead of offering it all together with like six different ingredients, put all the ingredients separately on a plate. Modeling for eating is always great. Have your child sit with you, sit with others when they're eating. When you're eating, even if they're not eating, you can read books, watch shows about eating, cooking shows, all of those things are great. Next slide. Food play can work on like pretend play and those kind of schemes. Um, Kids can help in the kitchen. Just be mindful of their abilities and their interests. And activities are also really good for social engagement goals. Always have a napkin available. Think creatively. I always say, like, don't just use a regular napkin. Like, some kids really like rough texture, so use like a really rough washcloth or like a very soft old t-shirt. That can really help them have some control. Like, I don't want things on my hand. It's okay. You don't have to get upset. We're just going to wipe our hands. Offer new foods that are similar in color, shape, flavor, texture as a food your child eats. So if your child likes fresh raspberries, you might try freeze-dried raspberries. You might try a strawberry popsicle. You might try the same color yogurt, strawberry ice cream. You're going to kind of stick to a theme. You might want to cut some chips that maybe are like a triangle shape similar to a strawberry. Always respect sensory preferences. We have sensory preferences, what we eat as adults. We can say like, no, I don't want to eat that. No, I don't like that. If you're talking to your doctor and you're finding that like nutritionally a child's doing really well, don't stress yourself out. Um, understanding that like just do they need to eat mashed potatoes? Is it really important? No, then that's okay. I don't eat mashed potatoes. It's okay. I've done okay. Um, and always think about your own food preferences. If you want a child to try a food and you're not willing to try it with them, then maybe it's not the best food to offer them. Try to limit snacking during the day. Some other things, try not to use food as a reward or as a way to help a child calm down or an activity to do when they're bored. Um, really work with and kind of brainstorm with the people that know your kids, maybe any professionals that might work with them, teachers. Think about other ways to replace like boredom, sensory dysregulation, and reward options. And then you're just really going to gradually introduce new foods and new expectations. Maybe it start with look at a food on a plate across the table, not, okay, take a bite of this food. Like I said, I always like to offer a small piece of a maybe food or a previously eaten food or family food, like something that everyone is eating together on a child's plate at a meal, or just like even on a small plate, like on the table, maybe a little bit down from them too, but at least in their sight. Next slide. Okay, I don't know if we're probably over time. Um, these are just some other things to think about. Divided plates and separate plates are great. Um, Slowly change a food. So some kids do really well with like you can hide foods in other foods. You can like blend vegetables and put them in a pasta sauce. Other kids are like absolutely not. So you really kind of have to like learn what kind of kid you have. Um, Things like if you want to get a child off an infant bottle, the biggest thing is sometimes I'm okay with like if you want to drink your Pediasure from a bottle, that's fine. I know you can drink soda from an open cup. So the skill is there. It's really kind of a preference. So that might be something where you'd work with more of like a behavior-based um, professional on that. And then allow choices within meals. Even if they seem like little choices to you or to the child, they're still choices for them. And I always say distractions are okay when eating, like watching a video, especially if you're concerned about nutrition or weight. You can also use like a video or something like that as a contingent reward. If you eat three pieces of this food or you try a new bite of a food, then you can watch Bluey. And then some kids like to, if they're trying a new food, like to keep track or you want to take like 3 bites of a food, or you want to do 3 things with the food. You want to look at it, you want to smell it, and you want to lick it. You can kind of check that off and you can build in some sort of reward there. Uh, and this is a reminder that like we as adults need to try food like over 50 times for our brain to decide whether or not we like it or not. So it's the same for kids. So keep re-offering a food. It doesn't need to be 5 times a day for 3 weeks, but don't not offer food in the future just because at some point your child kind of refused it. It takes a little while to for the brain to decide if they like it or not. And the more familiar something is, the less scary it is. So, familiarity like kind of breeds comfort. So that's just a helpful thing to remember. Okay. So any questions or any other suggestions that
There,
people would like to share?
there were no questions during the presentation. There was a great comment about, well, first of all, patience and persistence, because it's hard work, but it's worth it. And even like making